The structural breast lift is very, very interesting. Almost 15 years ago, I was at a meeting in Paris. There was an Italian plastic surgeon who presented a technique that I was just really astounded by his results. But I was so interested in what he was able to do that I took the time to figure out the operation, and have been doing it for over a decade now. The thing that's interesting about the structural breast lift and structural reduction and other forms of structural breast surgery is that it gets around one of the fundamental problems of breast lifts. With a normal breast lift, basically you're relying on the skin largely to hold the breast in its new position. And the problem is the skin of a breast that's descended has lost a lot of its tone. So you're relying on a really weak anchor, if you will, to hold the breast in place. So as the breast then settles back after most of the conventional breast lift techniques, the top of the breast hollows out. So a lot of surgeons get around that by putting in a breast implant, and that works, but the problem is it's going to make the breast bigger, which a lot of patients don't want. Number two, you have an implant, and implants, though we use them every day, they do have their downsides. I'm essentially able to do with a structural breast lift is take the lower segment of the breast down in the, if you will, in the middle of the breast, and release that in a way that I can tuck it up under the breast and then anchor it high up, and that then gives the volume just like a breast implant. Typically when a breast descends, it splays out. It's not just that it goes down, but it spreads out. The breast basically loses its structure and form. So here we're able to make this very, very compact breast and narrow the base of the breast. A lot of patients remark that they go to their doctor and they say, "Oh, you have had breast implants." Well, no, they haven't, because it's just natural tissue, which is always the best.